Dr. Alana Biggers is an internist and an assistant professor of medicine at the University of Illinois Chicago College of Medicine, where she received her MD degree. She has interest in achieving health equity through health outcomes research. Dr. Biggers currently has an NIH grant for research to study the effects of mindfulness meditation and sleep on type 2 diabetes and heart disease risk in communities of color. Welcome, Dr. Biggers.
Oh, thank you. Thank you for having me.
An absolute pleasure having you on. Dr. Rickers, I first want to kick things off with understanding why has this been your passion? Why study these interesting topics? Interesting in my world, but why study these topics around diabetes? What really led you to it?
Yeah, diabetes, other chronic conditions as well. So I do have a Master of Public Health in chronic disease epidemiology, and from Tulane University. And I will say that when I first entered into the program, I had no idea what to expect, but it really just kind of changed my world and changed my lens in, the disparities that I was seeing in different communities, it was able to give me the language behind there. So I went after I got my master's of public health. I did work at the CDC for about 3 years, and then decided to move on to medicine because I had this passion to kind of combine, population health with medicine. Oftentimes, these two worlds work, in silos. More so in the last, I would say, couple decades, there's been more of a push to definitely merge the two worlds. But I felt like that it was a space that I really could make an impact. So for me, also in between that time, between getting my master's of public health and going into medical school, something personally happened to me. My father died from a stroke. So he was a presumably healthy man, had a PhD in math, so very
Mm,
smart, had health insurance. So, all the reasons that you hear people saying that chronic conditions are in different communities, like lack of access to healthcare, et cetera. He didn't fit that bill. He even also worked out. He didn't eat sweets. He did, he was a presumably healthy man. But one thing that he would not do and didn't feel comfortable doing was actually going to see a physician. And so, like where my mom and, took us or herself to have annual visits, my dad didn't do that at all. He was at the university where he was teaching, and had a headache, went to his office and was found down. So had ended up having a stroke from undetected high blood pressure. His blood pressure at the time that it happened was in the 200s over 100s. And yeah, so, and unfortunately, my dad did not survive. So, I carried that with me and still carry that with me as well. And think about like maybe if he had a physician that he could relate
mm,
to, that he felt comfortable with, that, maybe he would have been less reluctant to go to a doctor. And so I know this, we're not talking about this today, but medical mistrust is a huge issue in different communities of color, for reasons that are very, legitimate historical reasons. So, I carried that passion with me too, going in. And I feel like I want to be, I guess, as an internist, be used, and giving information to different communities, different people, helping to empower them, and really wanting to, relate and connect, and see whether or not, hopefully, I can make a difference in someone else's life. The way that, unfortunately, it didn't happen for my father. So that's really does drive my passion for the work that I do.
mm-hmm. That is so interesting, and I'm so sorry to hear that. And thank you
Yeah.
for sharing that story. I'm sure it's got to be, it is painful, but at the same time, it
Yeah.
has that purpose around that work that you do is so mission oriented to say that this doesn't need to happen, right? Um,
Yeah.
yeah, yeah. But thank you so much for sharing
Yeah.
that.
Yeah, I always tell my students, that the work that we do as physician only accounts for about 10% of somebody's health, their overall health, and I feel
Mm,
like in my dad's case, he needed that 10%. So
mm,
yeah, so definitely, it, like I said, drives me, and hopefully, want to make a difference in someone else's life.
and thank you again for sharing that.
Yeah, no problem.
As we sort of look at this, and for our conversation here today, we really want to focus on understanding diabetes in particular, and also just try to understand, especially around your research, which is very interesting. We're going to come to it
Yeah,
in just a minute here. um, can you help us understand, just first let's talk about understanding diabetes itself, right? So,
sure.
uh, diabetes is usually a lifelong disease in which there are high levels of sugar in the blood. Help us understand how and why does our blood have high levels of sugar? Like, what is even causing it to happen in the first place?
Yeah, so diabetes is a metabolic disorder. So your body is a well-oiled machine, right? You have your
Mm,
heart that's pumping blood. You have your brain that is processing different neurons throughout the day and senses and kind of bringing it together and allowing you to take action, etc. And then metabolism, it helps with creating energy for your muscles and for your movement, right? So with diabetes, your metabolism is impaired in that case. So anytime you eat anything, your body breaks it down into nutrients that it can use, and like I said, it feeds the different organs in your body. So like your blood sugars will go up, and then your pancreas in particular creates a hormone called insulin, and so insulin will help to bring those blood sugars down, and also to help like get the blood sugars into the different organs. But with diabetes in general, that's impaired. So whether or not it's type 1 diabetes or type 2 diabetes. So if your body is not producing insulin, then those blood sugars have nowhere to go. So they're in your
mm,
blood, and in that, and over time that can cause damage to your organs in your body, whether it's your heart, whether it's your kidneys, brain, etc. So that's
mm-hmm,
a few basics on diabetes.
mm-hmm. And you mentioned the different types of diabetes. Can you help us understand the difference between type 1 and type 2?
Yeah, so type 1 is an autoimmune type of diabetes. So usually someone is diagnosed in their childhood, whether or not is with their baby or is it later on in life. Usually, sometimes it can happen in adulthood, but typically it happens within your early years of life. So your body is not making, your pancreas in particular is not making any insulin. So you are dependent on insulin for the rest of your life. Yes, diet and exercise is always good for you, but regardless of you doing diet or exercise, your pancreas is not making any insulin. So you need to have insulin, lifelong insulin with type 1 diabetes. Type 2 diabetes, on the other hand, is acquired diabetes. So your pancreas is working fine, and then things happen along the way, whether it's aging, sometimes that can do it. Being overweight, and we can talk about those types of risk factors too. But your pancreas is just not producing the same amount of insulin that it was before. There's a strain on it, so it's
Mm-hmm.
causing some of the similar effects with as type 1 diabetes, not being able to like process those and break down those blood sugars for you. So that is a majority of people have type 2 diabetes.
Mm-hmm. Okay, that's helpful to know. Now, in looking at type 1 and type 2 diabetes, you mentioned the most common one is type 2 diabetes. Can you help us understand why that type 2, I guess, is more common than type 1?
Yeah, so so type 1, again, it being autoimmune. it can run in families, can be genetic. But whereas type 2 diabetes, a lot of it honestly is driven by our higher rates of obesity. So
Mm-hmm.
people gaining weight, like I said, it can put a strain on your body. Just so you know, like even if you feel, if you've ever had weight gain and you're like, oh, my knees don't work as well anymore. So now you're like having your pancreas try to work harder to process different foods that you're eating and breaking down, sugars, etc. And it's just not working as efficiently as it is or as it was previously.
Mm-hmm.
So you're just not being able to put out as much insulin. And again, most of the time it is driven by weight gain.
Okay. And then, how does diabetes affect across racial groups?
Yeah, so unfortunately, it hits different communities of color differently.
Okay.
The American Indian, Alaska Natives, they have higher rates of type 2 diabetes, followed by non Hispanic Blacks, then Hispanic populations, and Asian populations, in that order. So it is more prevalent, like there were higher rates in different communities of color, and for multiple reasons. It's very multifactorial.
Mm-hmm. Can you talk about some of those factors? What kind of factors are
Yeah.
we talking about?
Yeah, absolutely. Again, unfortunately, a lot of it is driven by rates of obesity. So,
Mm-hmm.
there are higher rates of obesity in certain communities of color as well. But then, it's not just, you have to look at the bigger picture. I'll just say that. So it's not
Mm-hmm.
just like, oh, well, this population, there are higher rates of obesity, so that's why. But I always ask the question of why. Why is that happening, right? So again, very multifactorial. Neighborhoods, you have to look at that. There are, unfortunately, communities of color are at higher risk for living in under-resourced neighborhoods, and that lends itself to people not being as physically active, not having the green space, not having sidewalks, that type of thing. And in that case, that actually it puts them at higher risk for having higher rates of obesity, which again can lead to the type 2 diabetes. There
Mm-hmm.
are other factors as well. And like if somebody in your family has it, you probably have a higher propensity of getting it
Mm-hmm.
yourself. It's not I don't want to say it's definitely not a given, because I actually have heard people say things like that, like they're not surprised, like, oh, well, my father has it and my aunt has it, so it was a given I was supposed to have it, right? So yes, you are at higher risk for getting that, for getting diabetes, but that doesn't mean that you have to get it. So I just want to put that out
Mm-hmm.
there as well
Mm-hmm.
too. In certain communities of color, they're a higher risk of having what they call food deserts or food swamps, which
Mm-hmm.
where there are there's access to foods, but they're not of higher nutritional value. Again, adding to that those rates of obesity too.
Mm-hmm.
Another one, believe it or not, is sleep health. So sleep health is there's a sleep disparity amongst communities of color compared to other groups too. So not getting enough sleep,
Mm-hmm.
that can lend itself to type 2 diabetes, or yeah, sort of type 2 diabetes.
Yeah.
Yeah.
Perfect segue for me. Thank you for building that
Yeah.
up,
Yeah.
Dr. Biggers.
No
But
worries.
perfect segue into, going into that next topic, which is, you've done some research on this relationship
Yeah.
yourself. You've done this research on this relationship between sleep and type 2 diabetes.
Yeah.
Can you share with us what this relationship looks like, why it's important?
Yeah, so it's one of those things that I feel like is emerging over the last several, years in terms of the
Mm,
importance of sleep health. So you're hearing it more so in the news, but many people don't know that sleep health actually can impact your risk for getting type two diabetes. So
mm,
us as a nation, we're not getting enough sleep. Enough sleep is anywhere between 7 to 9 hours a night as an adult. Of course, the kiddos, they need more sleep, but go 18 and older, 7 to 9 hours is the recommended time. So, and sleep deprivation is people who get less than 6 hours of sleep a night. I have been
right.
guilty of it myself. So, um, but they have seen in multiple studies that people who are not getting enough sleep are at higher risk for developing type 2 diabetes, or if they have type 2 diabetes, worsening diabetes too.
Mm,
So, again, multifactorial, but one of the leading thoughts is that not getting sleep deprivation, not getting enough sleep can actually increase like your cortisol levels. That's the stress hormone. So
mm,
it impairs your ability to process sugars again, right? So yeah, so that they've seen in multiple studies that like after a night of sleep deprivation, that people end up having their blood sugar levels are off. And there are other studies that show that there's an association between low sleep or not getting enough sleep and type 2 diabetes. So that's
mm-hmm.
where that connection comes in play.
Mm-hmm. That's interesting. And so once that happens, so what I'm hearing from you is the cortisol has to do with it, which has that impact on that ability. It's almost like a ripple effect, right? Not enough sleep means that the impact on the sugar, which
Yeah.
means the impact on the stress, which means an impact on the sugar. So it's and so that's why when we talk about these are all the different risk factors, it is really the culmination of this, and then also the ripple effect that each of these factors have on one another that can also
Yes.
lead to that. So that's an interesting point. Tell us more about this research. What do you plan to gain out of it?
Yeah. And just to add to that too. Their communities of color are most affected by this,
Mm,
sleep deprivation and poor sleep health too, because they are at, higher risk for having like non-standard working times, right? Working overnight shifts and being up all night, or
mm-hmm,
non-standard shifts. So you
mm,
can see that again, Black, Latinx communities, they have higher rates of poor sleep health in general.
mm-hmm,
So that could
mm-hmm,
be a factor that's contributing to type 2 diabetes. So in my first study that I did, it was just an observational study looking at Black and Latinx populations with type 2 diabetes, and looking at their sleep health. So, yes, and needless to say that the sleep health wasn't as good as we hoped it to be. Um, in my current study, what I did was I wanted to, and this time, look at Black populations with type 2 diabetes and seeing whether or not a mindfulness meditation intervention could actually improve their sleep.
mm,
And with the end goal of hopefully improving their type 2 diabetes, and then type 2 diabetes is a risk factor for heart disease too. And then thus, improving their heart disease risk too, so or their heart health overall. So
mm-hmm,
that's what I'm hoping to see. There is literature in there that looks at mindfulness meditation. There have been some associations. So the research is mixed, but there has been some associations with mindfulness meditation improving your A1C numbers, for instance.
Mm-hmm.
Many of the or most of the research actually is not done in communities of color. So I thought it was important to focus on a Black African American population for this. It's a smaller study, so a small study to get some data going forward. So these community colors in general have kind of been uh, uh, largely left out of research that's related to mindfulness meditation. And again, we could talk a long time about that as well. But there are different movements that you see about bringing mindfulness meditation because it has, there are benefits to not just type 2 diabetes, but to improving sleep, improving stress
Mm-hmm.
levels,
Mm-hmm.
improving, feelings of pain that, chronic pain that people feel too. So, yeah, there's again, it's one of those emerging areas that have been going over the last couple of decades. And, I wanted to bring this type of intervention to this population.
Mm-hmm. Dr. Beckers, as you're sort of mentioning the sleep element, it's hard to not even see like a person who has diabetes, especially a person who's newly diagnosed with
Yeah.
diabetes, right? Trying to manage all of these different components
Yes.
of their lives and still trying to live their life and live everything else
Yeah.
that comes in it. What would you say to someone to say, okay, how do I get my 7 to 9 hours of sleep
Yeah.
and eat healthy and physical activity and manage my stress, mindfulness? What would you say to someone like that who says life is complicated to begin with? Now you're going to add all of these other
Yeah.
things that I have to do for diabetes. What would you say to someone like that?
Yeah, and it's like I just got diagnosed with this, and you're throwing all these things at me.
At me, yeah.
Yeah, I try to tell people to, Rome wasn't built in a day, and that, take it one step at a time. Honestly, start where you are. So,
Mm-hmm.
I give people, my patients, just general information about, diabetes, what their diagnosis could mean, etc. Of course, I give them the space to ask questions and to talk, etc. If leading giving people opportunities to meet with nutritionists and taking a class on diabetes, I think it's helpful. But in those, 20 minutes that you have with a patient, right? You try not to overwhelm them, but then you also try to instill in them that this is a time, I want you to feel empowered. So start where you are. If
Mm-hmm.
you are a person who is, I kind of go through like the foods, like I'm like, are you a, carb, person? If they don't know what that means, whether or not it's, breads or you like potatoes, etc. And if or rice, if they tell me that, I'm like, okay, well, I'm not telling you to cut out completely. I'm going to tell you to cut down significantly. We're talking about portion control right now. And then, like, if it is rice, I'm going to ask you to do some type of rice, white rice, like some rice substitute, right? So, like brown rice or quinoa or,
Mm-hmm.
something, barley, something that is more of a complex carb. So, we go into that discussion too, like, what's a complex carb? If
Mm-hmm.
someone's a potato person, I'm like, okay, well, sweet potatoes, believe it or not with the sugar in it though. It's a complex carb.
Mm-hmm.
Or, like red potatoes, but keeping the skin on. Again, portion control, but, get more of the complex carbs. If they're a sweets
Mm-hmm.
person, same conversation. So, we're cutting down significantly. We're not going to cut out. If you're like a soda pop person, I'm telling you, water is your friend, so we have those discussions.
Mm-hmm.
And you want to meet with them like more often too. So you don't want to just be like, all right, here you go, bye. And then I'll see you in 3 months and see what your new
Mm-hmm.
A1C is, right? So like, whether or not they need a 2 week follow up to check how their blood sugars are going, or if they, need to see them back within 6 weeks just to, see how things are going with with everything. So
Yeah.
yeah, so that's how I try to approach it. So try not to overwhelm them. You know, we also talk about like their physical activity. If they're not doing anything, all right, how about you just take a walk? You know, just a couple
Mm.
times a week. Or if
Mm.
there's somebody who can't get out or it's super cold, like I'm here in Chicago, it's super cold. You know, we talk about home exercises, or if there's somebody who they're not very mobile, you can do some exercises in your chair. Um, so I try to give people resources around that, and also I do ask about their sleep health too, and you know, like what's challenging for them, right? So if they're a
Mm.
person who it's hard for them to go to sleep, or they're noticing that they're snoring or something, you know, some type of sleep assessment, then okay, well then, you know, maybe we need to have you get assessed by a sleep doctor and do a home sleep
Mm.
test. If there's
Mm.
someone who watches TV and likes to have the lights on, we talk about sleep hygiene, you know,
Mm.
having dark room, no TV on, you know, keeping that blue light filter on your phone, even though I know that's a little, sometimes they say it works or it doesn't work as well as they say it should. But, you know, those are all measures to try to improve someone's sleep health.
Mm-hmm. And I appreciate you going through that because it is also incredibly hard to find doctors like that who are taking the time to explain those things, which is like a whole another episode that we need
Yes.
to have a
Yes,
conversation about.
absolutely. Yeah.
But with that, for this episode, we are toward the end of time here on this episode, Dr. Biggers. But at this time, I would love for our listeners to know how they can connect with you and just to learn more about your work after this.
Yeah, absolutely. So you can connect with me in different ways. Dr. Alana Biggers on Facebook. Dr. Alana Biggers actually on Instagram as well. My Twitter is doc underscore prevention. And I feel like that's probably all of the different ways you can connect with me. I'm still working on
All
the
of the social
website.
media.
Yes, exactly. All of my social media. I do have a website that we're building as a landing page. So when it becomes live, it is dralanabiggers.com. So,
Lovely. Lovely.
yeah,
And thank you, Dr. Rigger, so much for
of
coming on the
course.
episode and chatting with us. To our listeners who are listening out there, get over to our social media. Find us on Facebook, find us on Instagram, find the post for this particular podcast episode, and answer this quick question. How are you managing diabetes for yourself, for your family members? So get over to our social media, answer this quick question. Again, you can find us on Facebook at Yumlish, or you can find us on Instagram at Yumlish underscore. Get over there, find this post for this podcast episode and answer this quick question there. Dr. Biggers, it was such an absolute pleasure having you
Yes,
on. Thank
thank
you
you.
so
And
much.
thank you for having me here.
Absolutely. Thanks.
All right.
In today's episode, we will be talking with Dr. Alana Biggers. She's an assistant professor of medicine at University of Illinois Chicago and is passionate. In today's episode, Dr. Alana Biggers will be discussing how and why people develop high blood sugars, get diabetes, the different types of diabetes, and then the relationship between sleep and type 2 diabetes. Stay tuned.